I wanted to share some tips on if an individual, especially a man with pelvic health dysfunction, is having bladder urgency. So one of the biggest things that we see that is causing bladder urgency is caffeinated drinks as well as any carbonated drinks. What we do is we go through what we call a bladder diary as well as a fluid intake diary. And when we start mapping out what people are intaking into their system, a lot of times in the morning we have worse urgency, as well as right before bed. Once we break that down, caffeine is a big bladder irritant as well as carbonation. So what we do with people is we look at their water intake versus their coffee, tea, energy drinks, soda. Even seltzers are a part of this because they're carbonated. So what we want to do is we want to back down the carbonation. We want to back down the caffeine as much as we can, which really helps that bladder and make sure that we can help let that bladder fill up and let it be relaxed, because when it's irritated, it wants to get rid of that fluid. So if you're having bladder urgency, something to really focus on is make sure you take a documented look and actually objectively look at how much caffeine you're drinking a day as well as how much carbonation you're having in your drink. Try this little tip if you're having bladder urgency. I'd love to try and help you here in Fox Point. So if anyone's having any male pelvic health dysfunction, please come and see us here at Fox Point. We'd really like to help you.